If you have chronic back pain, in fact, you may have already had 1, 2, 3 or more back surgeries and you're still in pain, there is a solution out there for you, and it's often spinal cord stimulation. And it involves a small stimulation wire, much like a pacemaker wire that people get put on their hearts. We can use similar wires to send electrical signals into the spinal cord. It can interrupt or interfere or change the way that pain signals are processed. The first step is simply a trial. We temporarily place these tiny leads. There's no stitches, there's no cutting, it's not a surgery. It can actually be done in the office. It's a procedure that usually takes 20 minutes and you're able to go home that same day. Most surgeries, you don't get to try it before you actually have it done. At the end of those 10 days, we do an extensive assessment. How much pain relief did you get? If it was successful, then we proceed to the second step. It's a minor surgical procedure where we implant these leads permanently in your spine. Now, this does not involve spine surgery. It's just a minimally invasive, small surgical procedure where we place the leads and anchor them so they won't move, and we place a tiny battery. It is very thin. After a few weeks, after that heals up, you'll forget it's even there. Something else that causes really horrendous pain for people is neuropathy, peripheral neuropathy, where they get burning, stinging in their feet. Spinal cord stimulation can not only reduce the pain of diabetic peripheral neuropathy, but it may even help patients regain sensation in their feet. The data shows in 80 to 90% of patients, 50 to 100% of pain is gone. In 2/3 of patients, more than 80% of the pain is gone. We're talking about people's average pain scores going from 7 or 8 down to 2. So it's a life-changing technology for many patients. For a very long time, the only options we had to treat people in chronic pain were medications, which often had a lot of side effects, and in the long run, they often did more harm than good. At Texas Pain Care, we're extremely proud of the fact that we can offer state-of-the-art treatments like spinal cord stimulation. In fact, we're one of the leaders in spinal cord stimulation, dorsal root ganglion stimulation, and other forms of nerve stimulation that can reduce pain significantly.